I'm sure. Okay, everyone. Welcome to our Lunch and Learn today. I'm your instructor for today. Most of you know me. My name is Amy. I just want to point out a few things. If you get too uncomfortable as far as the temperature of the room or the lighting, please let me know. Most of you know that our restrooms are out here and down the hall, so if you feel like you need to take care of needs, please do so. I know you're eating, so continue to eat. There will be a few times where I may ask you to stop eating for a moment so that you can interact with each other. But for the most part, I just want you to go ahead and finish up your lunches in a comfortable manner. Today what we're talking about is how to listen better. And several of you have already mentioned listen is not spelled correctly. And no, it's not. There's a reason why. So that will all be revealed in good time. You've also noticed that I've given you a training manual that's going to be yours to take with you. There are some places in there to fill out some blanks, to take notes, and those types of things, because the PowerPoint up here is just going to have a few things on it. It's not going to have the full lecture, so I wanted to give you a manual that actually has more details that you can refer to later. So as you'll see, the first thing that we're going to talk about is just the fact that I'm providing this training for ACU. I just want to remind you again, you are being filmed, and at some point during the process, when we do group activities, we will be panning out to the audience, and so we will be looking at you and your interaction. If you have questions, we'll probably record that also, so that way we'll be able to know what those questions were and record the answers for later reference. So I have given some presentations at other places. This is my first presentation here. So if at any point I'm not speaking in a way that's able to be heard, or you're confused about what I'm saying, or I'm talking too fast, which I tend to, please let me know so that way I can stop and pause and slow down for you. Most of you filled out for me a pre-training questionnaire, and I've been looking through those for some feedback. Most of you talked about, for this training, you really want to get something new and different, so that's what I'm trying to bring to you. As we go through the slides, if I know it's something that you guys have mentioned, I already know about that, I don't feel like I need to get more info, then I'll kind of go past that and get into the projects that I know for sure, like our role play activity, that I know for sure are things that you have asked for as far as better communication within our department. And so one of the things I'm going to let you do first here is we're going to do a little icebreaker. And I think most of you probably played it before. It's called telephone. If you have food in your mouth, you kind of have to finish chewing because you will have to talk as you play telephone. I've already rearranged you so you're in kind of two lines, okay? So the front row will be 18, and the back row will be 18, okay? And so what we're looking at is how messages are sent and received. And for telephone, I'm going to give the senders, the initial senders, a message. They're going to whisper it to you, okay? You can't ask questions. You can't ask for clarification. You can't ask them to repeat it. And then when we get to the end, we're going to see what kind of message you ladies got on the other end, okay? All right, so I'm going to start back here. Okay, so we got our way through the telephone there. All right, Caitlin, what message did you end up with?
This is the best training I've ever been to.
Okay, what did we start out with?
This is the best training I've ever been to.
Thank you. All right, John, what did you start with?
This is the best training ever.
What did you end up with?
This is the best treat ever.
Treat ever. Okay. So back row, we got some good listening going on. I think y'all are hoping for a treat. That's what happened. Okay. So you can see that there were a few places in there maybe something didn't get communicated exactly correctly. So we ended up with something that wasn't quite the same. And sometimes that happens to us at work. Sometimes it happens where we think we're communicating very well with a coworker, or we think we're communicating very well with a patient or a patient's family. And then later on we find out, oh, that wasn't really the message that that person received. So part of our goals for today are to give you a chance to talk about what effective interaction looks like, what our communication looks like within our department, what our communication looks like with other departments, because we don't stand alone, and what our communication looks like with our patients and families, because all of you said on your surveys and your interviews, that was the place that you put the most importance on, was patient care and patient interaction. So we want to make sure that whatever we do communication-wise, which includes us communicating with each other, supports patient care and the patient interaction that we end up providing.
I didn't get that answer right because I didn't understand the question.
You didn't understand the question? Charlie. Okay, so our learning objectives today I've mentioned for you in your training manual, I believe, are that we're going to identify and demonstrate through role play some of the most important techniques that we have of active listening. We're going to try to create some common terminologies. And those are the things that everybody got kind of hung up on in both our interviews, our surveys, and the pre-questionnaire. And that was because I realized when we started doing the surveys and the interviews that we had a lot of people who were like, well, we used to talk about exercises in like a common term, like angel wings, or milking the cow, or something to that effect. And then we had a group of people who were saying, well, I like to communicate it based on the muscle movement, mid-trap exercise, anterior deltoids. And then we had another group of people who were putting it into very common layman terms. Lift your leg, bend your knee, lift your bottom up. Something that was very simple for patient care, but maybe when we talk to each other as coworkers, it didn't translate quite the same. So that's why that question on all three of those areas kind of got like, I don't know exactly how to answer this, because we haven't created a common language with each other from what I could gather from doing the surveys and the interviews with y'all. So it's one of the things we're going to work on. And then the last one is talking about what assertive communication looks like. Because we do have in our group some people who are more quiet. I know I'm not one of them. But there are some people in our group who are more quiet, and maybe they have questions, or maybe they don't understand something, or maybe they're not sure how to tell somebody, oh, I don't know about that, or how do you do that, or I don't know if I want to do that with that patient. And I just want to give you some ability to be able to be assertive in your communication, which is just a way of asking those questions respectfully and getting your point across and making sure that the lines of communication stay open. So that's one of the things that we're going to talk about too. So our schedule is already in the manual for you. We're going to move on through it, so if you have time, we're off a little bit on time because we're waiting for people to get meals, but that's okay. You also have a table of contents, so later on if you think, I want to go back and I just want to know something specifically about the group think activity, then you can look through your manual and you can go directly to that page where you made your notes, okay? We've already talked about telephone. Let's get through that. And I talked to you some about the results of the survey and the interview. But what I didn't mention is that when I did the original surveys, no one really mentioned any kind of problems in any area. But when I went into the interviews with one-on-one and you guys started talking, you mentioned 16 times some type of communication as being a possible problem. And out of those times, 50% of that was about interpersonal communication with something in our department. So either between us as therapists, or us with an aide, or us with the front desk trying to get somebody scheduled. So it's not that we're not good at it, it's just that maybe we all agreed it's a place where we needed more training. And that's what I got from your surveys and your interviews. On 3 interviews, it was noted that, like I said, trying to find a common name for something or agreeing on terminology or jargon, that was a little bit of a problem. And on 5 different interviews, people reported that it was difficult sometimes to explain what technique or what exercise they wanted done to someone else, and that they didn't always check for understanding. So that was something that became very clear as we did the interviews. So let's talk some about interpersonal communication. And some of the information I'm pulling today is from a book on organizational behavior by Nelson and Quick. So if you're interested in looking at that or reading it, I have it available. And some of the information I'm pulling is from Fisher and Urey's Getting to Yes. So when I reference them, they're up here. You're welcome to look at them and see. Everything that I've pulled together is based in either evidence research from the books and the literature, or from evidence-based by spending time with y'all and getting information from you. So for interpersonal communication, I've already mentioned this. Sometimes the communicator is saying, this patient should perform the angel wings exercise. And the other person is saying, okay, I wonder what kind, or what does that mean exactly? And it may mean something different John may say, I want you to do angel wings, but I'm focusing on mid-traps. And I may be saying, I want them to do angel wings, but I'm concentrating on deep breathing. So different aspects of each exercise may or may not be communicated to other people. So we talk about interpersonal communication. There are different parts to it, and there are some fill in the blanks here if you guys want to fill these in. According to Dixon and Hargy and Morrow from 1996, this interpersonal communication can include a range of skills, and this was specifically an article about health professionals. And when they surveyed health professionals, here's what they found should be included as far as interpersonal communication. This is on page 9 of your manual. Nonverbal communication. I have an extra pen if somebody needs it. Questioning. Listening. I'll repeat these in a minute. Explaining. Reinforcement. And assertiveness. So again, these are things that were found in this research for health professionals, that these are things that you would do on a daily basis as part of your interpersonal communication. Nonverbals, which several of you mentioned on your pre-questionnaires as being a big part of communication. Questioning, listening, explaining, reinforcement, and assertiveness, which is another reason why I added assertiveness in, because it was found to be a crucial point for us to have as professionals. And interpersonal communication occurs between two or more people, and it's vital in building, these are the blanks, and sustaining human relationships at work. And that's from Nelson and Quick. So they recognize, as they've done their studies of organizations, that part of what sustains a group and makes them effective over time is that people have a good communication with each other, and they sustain the relationships they have with each other through communication. All right, and if you look at the next page, we have some, what are some parts of interpersonal communication? This again comes from Nelson and Quick, 2015, so very current information. And this is what you just did in telephone, very simplified, of course. We have something that's way more detailed on a daily basis. The communicator is sending the message. Such a first thing. The receiver is receiving the message. And the message that we give, whether it's about exercises, or are you going to get to go back home when you get out of the hospital, or is your parent going to be there to help you do these exercises at home,